Welcome to the spoken tutorial on feeding expressed breast milk to babies. In this tutorial, we will learn how to make stored breast milk ready for a baby to drink and how to feed expressed breast milk to a baby. Let us begin. Expressing breast milk has many benefits for the baby and the mother. Expressing breast milk and storing it safely are explained in other tutorials. Now, let us learn how to make the stored breast milk ready for the baby to drink. Before handling breast milk, the caregiver must wash their hands with soap and water and dry their hands well. Remember, the oldest stored breast milk should always be used first. When using frozen breast milk, ideally defrost it by keeping it overnight on the lowest shelf of the fridge, and use this defrosted milk within the next 24 hours. But if the frozen breast milk is needed quickly, defrost it outside the fridge by first keeping it in a container of cold water and then keeping it in a container of lukewarm water. While defrosting in lukewarm water, shake the breast milk container gently and occasionally. Do not shake it vigorously and continuously. Dry the outside of the breast milk container with a clean cloth before use. Use this defrosted breast milk within 2 hours and throw away any unused milk. Defrosted breast milk can smell and taste different than fresh breast milk. It is fine as long as the baby accepts it. The caregiver must always smell the breast milk before feeding it to the baby. If the milk smells sour, do not use it. Please remember, when breast milk is stored, it will separate with the cream rising to the top. This is normal. Shake gently to mix the cream back in the milk before use. To warm the breast milk just before feeding it to the baby, keep the breast milk container in a bowl of lukewarm water for 20 to 30 minutes. Test how warm the milk is by dropping a little onto the wrist. It is right when it feels warm. Do not use hot water to warm the breast milk. Try to use stored breast milk straight from the fridge. This will help to avoid the risk of overheating and burns. Do not heat breast milk by keeping it directly on a stove or in a microwave. Direct heat destroys many of the infection-fighting factors present in the breast milk. When the breast milk is ready, offer it to the baby. To do so, the following utensils can be used: a paladai, a small cup, a spoon, or a nifty cup. Out of these, it is preferable to use a spoon or a cup to feed the baby. Firstly, the caregiver must wash the chosen utensil with soap and water and then air dry it completely or wipe it dry with a clean, unused cloth. Then, the caregiver must wash and dry their hands properly. They should half fill or 2/3 fill the chosen utensil with breast milk. Then, they should hold the baby in a nearly upright position on their lap. Their hand should support the baby's head and neck. If they are using a paladai to feed the baby, they should position the tip of the paladai inside the corner of the baby's mouth. It should be held lightly between the baby's lips. The tip of the paladai should lightly touch the baby's upper lip. In this position, the milk should stay at the rim of the beak of the paladai. As the baby slurps milk, The caregiver should tilt the paladai slightly to keep the milk at the rim. If the caregiver is using a small cup to feed the baby, they should hold the cup lightly between the baby's lips. The rim of the cup should lightly touch the baby's upper lip. They should tilt the cup slightly until the milk reaches the top edge of the cup. This should let the baby take the milk from the rim of the cup. If the caregiver is using a spoon to feed the baby, they should hold the spoon between the baby's lips. The edge of the spoon should lightly touch the baby's upper lip. Then, they should tilt the spoon slightly until the milk is at the edge of the spoon. Feeding with a spoon is good for the first few days after birth, because during these days only a small amount of milk is needed. If the caregiver is using a nifty cup to feed the baby, they should position the small reservoir of the nifty cup just inside the baby's mouth. As the baby slurps the milk, they should tilt the cup up slightly. This will add milk to the reservoir as it empties. When feeding expressed breast milk to the baby, never pour milk into the baby's mouth. This may cause the baby to choke. Instead, keep the milk at the rim and leave it in that position throughout the feed. Always ensure that the baby is fully awake, alert, and interested in feeding. If needed, wrap the baby to prevent her from knocking the cup out of the feeder's hands. Always let the baby slurp milk at her own pace. Look for signs which show that the baby has had enough milk. Signs such as holding her hands up, falling asleep, or closing her mouth. Remember, do not apply too much pressure on the lower lip of the baby. Always let the edge of the utensil touch the baby's upper lip lightly. Do not put the cup, paladai, or spoon too far inside the baby's mouth. Never feed a baby in a lying down position. Do not use a feeding bottle to feed the expressed breast milk to the baby. After feeding the baby, wash the cup, paladai, or spoon well with soap and clean water and let it air dry completely. Some babies are reluctant to take expressed breast milk, particularly at first from some people. They may be less reluctant when someone else gives it to them. If expressed milk is refused by the baby, try not to worry. On the mother's return from work, the baby will make up any missed feeds by breastfeeding more often or for longer. Remember, keep the breast milk safe by washing hands, containers and utensils, feeding milk as soon as needed, or storing it safely. This brings us to the end of this tutorial. Thank you for joining.